Hi, my name is Allison Hartley, and I am a student nurse with Nightingale College. Today I am going to be performing a Foley catheter insertion for my female patient. So I'm going to knock and wait for my patient's permission to enter their room, perform hand hygiene, provide privacy by closing the door and or curtain, and introduce myself and explain what's going on. Hi, my name is Allison. I'm going to be your nurse today. What is your name and date of birth? All right, I'm going to verify that on your wristband. Perfect. Today I'm going to be inserting a Foley catheter. It might be a little bit uncomfortable, but it should only take a few minutes. Is that okay? Okay, perfect. I am going to put on some clean gloves. And perform some cleaning on my patient. So taking the first corner, my first washcloth, going into some warm water with soap. I'm going to start on the side farthest away from me, from the top to the bottom. Go to a new corner. Side closest to me, top to bottom. New corner, down the middle, top to bottom. New washcloth with just water. Side farthest from me, top to bottom. New corner. Side closest to me, top to bottom. New corner, down the middle, top to bottom. Last washcloth is to dry them off. One corner, side farthest from me, top to bottom. New corner, side closest to me, top to bottom. New corner, down the middle, top to bottom. All the while, as I was cleaning my patient, I was observing for skin integrity, looking for any redness, any discharge, any odors, just making sure my patient is healthy and skin integrity is intact. I'm going to get rid of my washcloths, discard of my gloves, and perform hand hygiene. Now I have the Foley catheter pack that I'm going to get out. I could use this as trash next to me with my patient, or I can just discard of it. I'm going to begin to open up my package. I'm going to take this shiny side down with my patient. I would ask them to lift up their hips so I could place this farther beneath them, and then for them to hold it in place. I'm going to continue opening this up. This is my sterile gloves. Take that last corner. Now I'm going to open up my sterile gloves and put them on. And I can get rid of that paper. Next, I have this to cover up my patient. And I will be telling them I am applying this, so you'll feel me touching you. This is just a drape to help cover it and keep you clean and to perform the action. Then I am going to prepare the rest of my kit. I have the remaining supplies here. I'm going to remain sterility of my gloves. I'm going to open up my swabs, get it prepared, easy to access. I have 3 of them here. I have my lubricant. I'm going to open it, and I will lube up just the tip of this. Get that ready. And also attach the syringe to there. Okay. Now I'm going to take my swabs. I'm going to explain to my patient that I'm going to start to clean them, so they will feel me down there. And I'm going to take one swab, start on the side farthest from me, like before, going from top to bottom, getting rid of that swab, going to the next one, top to bottom, from the side closest to me, last one, top to bottom, down the middle. Now, I'm going to take my catheter, grabbing it 2 to 3 inches from the lubricated tip. I'm going to ask my patient to take a slow, deep breath to insert it. And when they are ready, start that process. Once it is in, I can push my syringe and the balloon will start to fill. I'll give it a slight tug to make sure that it is in. I will make sure that this is attached to my patient. And attach my bag down to the mattress. I'm going to remove the rest of the supplies that I no longer need. Remove and discard my gloves. Perform hand hygiene. Ask my patient, is there anything else that I can do for you? Do you have any questions for me? Put them back into a comfortable position. Give them their call lights and instruct them to call me if they need anything.